There we go. Let's finish up and talk about the axial skeleton. Drag you down here. Vertebral column, and I apologize from the last time we had all those technical difficulties. It was very, very frustrating. I know for you, especially for me. It was driving me crazy. So let's hope that that doesn't happen this time. Okay, so let's jump into the vertebral column, your spine. Okay, and I'm hoping that after this you'll have a nice appreciation for the spine. But let's start off talking about the bones of the spine. All right, we call those vertebrae, and we have 24 individual vertebrae. And we'll talk about the different regions here momentarily. And then those 24 individual vertebrae sit on top of these two structures here, the sacrum and the coccyx. And both the sacrum and the coccyx at one point were also individual vertebrae that have fused together. The sacrum used to be 5 individual vertebrae, but they fused into one bone, and the coccyx was about 3 to 5 vertebrae, and that fused into one bone and then attached itself onto the sacrum. Okay, so basically your vertebral column is going to give you vertical support for your body. Obviously your neck, the cervical region of the vertebral column, will help to hold up your head. But if it wasn't for the vertebral column, we would not be able to provide ourselves with that upright position when you're standing or sitting. But we talked about the skull and its importance because one of the many functions of bone is protection, and it protects the brain. Well, the vertebral column is going to protect the spinal cord because that's where the spinal cord lives, right in your spine there. So you can see a couple different views here of the vertebral column. All right, we have an anterior and a posterior view, and then a lateral view. Now, when you're looking at the anterior and the posterior view, it's pretty much straight up and down, straight up and down. But you notice when you're looking at the spine from the side here, we have these curves here, and those curves are necessary. We need to have them. I have talked to engineers, and again, that's outside my wheelhouse when it comes to engineering, but when they have studied the spine, they do consider it to be an engineering marvel because of those curves, and we'll talk about this here shortly. Those curves will provide a lot of functionality, flexibility, and support and strengthen the spine. But I'll talk about that in a second. So when we're talking about the vertebral column, you have 5 divisions: cervical, thoracic, lumbar, sacral, and coccygeal. All right. So when we're wanting to talk about one of the bones in any of these regions, all right, what we do is we'll mention the region and we'll just use the first letter of that region. So if I want to talk about the thoracic, all right, and let's say I want to talk about the 5th thoracic vertebrae. There's 12 vertebrae in the thoracic division there. If I want to refer to it, I would call that vertebrae T5. And then you would know that I was talking about the 5th thoracic vertebrae. There's 5 vertebrae in the lumbar spine. So if I wanted to talk about the last lumbar vertebrae, I would say L5. Right? And if I was talking about the neck and I wanted to talk about the 2nd vertebrae in your neck, I would say C2. All right, so that's what we do. We just take the capital letter of whatever region, and then we throw a number behind it, and that tells us, okay, which region we're in and what vertebrae we're talking about. And we always number downward, okay? Meaning, all right, the lower the number in the division, the higher it is in that area there. So if I want to talk about the very first vertebra in your spine, the one that articulates with your skull, all right, I would call that one C1. Then the last vertebrae in your neck, okay, there's 7 cervical vertebrae, I would say C7. Okay, so it always, as you move down the spine, the numbers will increase until you move to the next division, then you start over again. Okay, so here you can see all 5 spinal regions here in our lateral view of the spine. So in the cervical region, we have 7 vertebrae. You need to know these numbers. In the thoracic region, also known as like the mid-back area, you have 12 vertebrae there. In the lumbar, you have 5. And then the sacral region and the coccygeal region, all right, they've all fused, so those are one apiece. So the sacral region, you have one bone, and the coccygeal region, you have one bone, okay? But at one point, they were individual bones that have since fused together. All right, so when we're talking about the first division of our spine is the cervical division. And this is going to be the area that makes up your neck. You have 7 vertebrae there. So C1 is going to be the most superior, and C7 is going to be the most inferior. So C1 articulates with your skull. Specifically, you should know these structures, the occipital condyles, because we saw those, they sat on either side of the foramen magnum. Okay, and then C7 is going to articulate with the first thoracic vertebra, also known as T1. All right, that's the cervical. And here you can see, all right, all the different bones here in our cervical spine. You can see it a little bit better over here. Okay, so there's 7 of them. And those vertebrae make up your neck. And you can see a nice x-ray here of the cervical spine. All right, one thing I do want to point out, this person has a relatively straight neck. That's not good. Okay, you should have a normal curve. The normal curvature of the neck goes, you'll see a nice C-shaped curvature like that. Okay, the next division is the thoracic division. All right, so we have, all right, 12 vertebra in the thoracic division. And each vertebra is either going to articulate with 1 or 2 pairs of ribs. Okay, a pair meaning you have a left one and a right one. Okay, so some of the vertebrae, so basically each vertebrae will at least articulate with 1 pair. Some vertebrae will articulate with 2 pairs. Okay, so the thoracic vertebrae are the only vertebrae that articulate with ribs. No other division articulates with ribs. So the most superior vertebrae in this division is called T1. The most inferior is called T12. So usually when I'm discussing the thoracic region or division of the spine, you know, and I want to use layman terms, I usually call it your mid back or even your upper back. Okay, so the last vertebra in the thoracic spine will articulate with the first vertebra of the lumbar spine, otherwise known as L1. So here you can see all of the thoracic vertebrae. Now look at this bone over here, this guy. Tell me that's not an irregular bone. Right? It's a strangely shaped bone. And so that's what vertebrae, all right, that's what they appear as, all right? They're oddly shaped, and we'll go through all of those. So here you can see all the thoracic vertebrae, and all the thoracic vertebrae will articulate with at least 1 pair of bones. Of ribs. And does anyone remember from lecture what classification a rib is? Is it a short bone? Is it an irregular bone? Is it a long bone? Or is it a flat bone? Does anyone remember? Ooh, we got some answers. Let's see what we got. Oh, wonderful. I love you all. Perfect. Yes, flat bones. Great, 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 great. You're paying attention. I love it. Okay, good. You'll never get that wrong on a test. All right, the next division of the spine is the lumbar division, okay? Also known as the low back. I never call it the small of the back, but whatever, okay? The lumbar vertebrae, you have 5. The most superior vertebra is L1. The most inferior is L5. And L5 will articulate with your sacrum. Now this says the first sacral vertebra, but they're all fused. So it's going to articulate with the sacrum, which is that triangular bone that looks something like this. Okay. That's the lumbar spine. Again, no ribs are in the lumbar spine. So you can see here, this is the low back area, right above your hips. Right, and so you can see the shape of this of the vertebrae here. Okay, again, an irregular shaped vertebra. Okay, and then the next division, ooh, is a nice x-ray here. You can see all the different, this person has a decent curvature in their spine right there. That's what we would like to see in the lumbar spine. We don't want to see it straight. Okay, we don't want to see too much of a curve in there. Okay, looks pretty decent. All right, the fourth division is the sacrum. Okay, at one point, there was 5 individual vertebrae. They've all since fused. They fuse completely by your late 20s. So if you're in your late teens or early 20s, this bone is still fusing, okay? But one thing in particular, this bone is going to articulate with your hip bones, and it's going to make up your pelvis. Okay, the sacrum helps to contribute to your pelvis. And then inferior to the sacrum is going to be your tailbone or the coccyx, or your first coccygeal vertebrae. All right, so there you can see in the picture there how the sacrum on either side of it, all right, is articulating or connected to a hip bone. And then finally, the last division of the vertebral column is the coccygeal division. All right, that bone we call the coccyx. A lot of folks refer to it as their tailbone. There's been many times in which people have injured themselves. Okay, so where they've fallen on their tailbone and broken it, and you can see it because normally, if you're looking, here's the sacrum here from the side, looks something like that. And then the tailbone kind of comes off like here, okay? And when someone breaks their tailbone, a lot of times when you're taking an x-ray, okay, you'll have the sacrum here, and then the tailbone is like that, okay? Yes, that's true. Yep, that is true in some cases, and it really depends. I mean, that's usually, it could be a big baby. There's several reasons. And it could be also because maybe that woman had unfortunately fallen before she'd gotten pregnant many, many years before, and she had a displaced tailbone where it's moved. Yeah, I mean, there's tons of different possibilities. But yep. Thank God it doesn't happen every time, because I have a feeling there'd be a lot of people that would not have kids if that were the case. But the coccyx can, all right, fuse to the sacrum. Doesn't always, but it can. So here you can see the coccyx there at the bottom of the sacrum, the inferior portion there. And mainly, it's not a weight-bearing structure. Actually, there's lots of ligaments and soft tissues that attach onto the coccyx. That's why people that do fall on their rear end and break that, they can have issues in other areas, not just around their tailbone, because of the other soft tissues that attach to the coccyx there. Okay, so you noticed when we went and I showed you that one slide there with the different views of the spine, when we were looking at the lateral view, it had those curves there, right? We have our spinal curves. And so the spinal curves come from the 4 different divisions of your spinal column: cervical, thoracic, lumbar, and sacral curve. Now, here's the thing, all right? Because of these curvatures, one, all right, it allows for that, some of that flexibility that the spine has, all right, but it also helps for the support of all the weight. Okay, now again, this goes back to engineering and all that fun stuff. If the spine were straight, you would not be able to bear as much weight as you do with those curves. Also, if the spine were straight, that would tension the spinal cord, and then you'd have a whole nother host of issues. So the fact of the matter that there's curvatures in the spine, all right, alleviates tension off of the spinal cord. Spinal cord is very sensitive structure. Some of you may know this because you may have experiences with disc herniations and all this other stuff. But the spinal cord is very, very, I don't want to say delicate, but it's fragile. It's very fragile. Okay, so if we were to straighten out this curve here, this whole thing, right, that would tension out the spinal cord. But because of that curvature that you're seeing there, it allows the spine to better support any of its weight-bearing function. All right, so when you're born, okay, you have one curve in your spine. Here's the baby, here's the spinal cord, or not cord, the vertebral column, and it's one curve. Okay, so you're born with the primary curves. Okay, so you look like a big C, and that is in the thoracic and the sacral regions. Okay, so that's the only curve that's present. Now, the secondary curves will start to develop through the early portions of the infant's life. All right, so the secondary curves that we'll see as we start to move our weight around and you start to bear weight, we start to get our first secondary curve around 3 to 4 months when the baby starts to lift its head up. So now, when baby starts to lift its head up, it starts to get its first secondary curve. All right, that's the neck. Then here comes the mid back and low back again. All right, so now it's able to hold its head up. Okay, here's baby's nose. So that's when it gets its first secondary curve. That's a cervical curve. The second secondary curve is the lumbar curve. So that's when the baby starts to stand or walk, you start to get another secondary curve, and that is going to be in the lumbar region. So primary and secondary curves, your thoracic and sacral are your primary curves, and then your cervical and lumbar are your secondary curves, and those come with milestones, baby milestones. Lifting the head, okay, is the first time, that's the cervical curve. Then when you start to stand and walk is when you get your second secondary curve there in the lumbar spine. So let's talk about some spinal curvature abnormalities. The first one here is called a kyphosis. This is that person that has the hunchback in the thoracic division of the spinal cord. We see it quite a bit in women, especially women that are older because of osteoporosis. We're starting to see an even larger amount of kyphosis because of smartphone usage and computer usage. Right? When people are constantly in that bad position of looking down and hunching their shoulders forward because they're on their phones a lot. So in the next couple of decades, you're probably going to see more and more people with a kyphosis in the thoracic spine. I'll show you some pictures here in a second. All right, a lordosis is an exaggerated lumbar curvature. More often you'll see it in men because we like to put our weight around our belly. And so because as we add more and more weight around the belly, you will start to try to compensate and start doing back bends, and you'll start to see an increased curvature in the lumbar spine. Now, most of us are familiar with this term here, scoliosis. All right, and that's a lateral curvature that we see in the spine. And it can be anywhere. It could be in the cervical, lumbar, thoracic. It's all over the place. It could be in all of those divisions. It can be in one of those divisions. All right, so it's very common. And if it's really, really bad, it may require surgery. Okay, I have a patient that had a really bad scoliosis, and he's got rods in his back. They're called Harrington rods. They put those in extreme cases. And if he didn't have those rods, he would be bent over like a pretzel. Now, the Shriners Hospital, they have started a back bracing program there in which they don't have to do surgery, but they start to intervene at a young age. And what they'll do is they'll take an x-ray of the patient, all right, usually kids, they measure the curvature, and then they make a special brace. And then they put you in that brace, and you'll be in that brace for about 23 hours a day. And then 6 months passes, you come back in, they x-ray you, and if there's an improvement, they make you a brand new brace, and they stick you in that. And so they keep doing that until that scoliosis goes away, or it's as close to normal as they can get it. There's no 100% guarantee. It's a relatively new program, so we're still kind of waiting for the long-term effects. Hopefully it'll be successful. Anytime you don't have to do surgery is a good time. Oh, you know what, Christina, that's a great question. It varies. It's usually going to be years. Think of it like braces, all right? Braces on your teeth. Okay, it varies from person to person depending on how bad the misalignment is. So again, it's really hard to say. If it's a relatively minor scoliosis, it could take a few years. If it's a pretty significant scoliosis, it could take up to a decade or so. Yeah, it is brutal. Yeah, scoliosis surgery is no joke. So here's what we're talking about. We're talking about our different types of curvatures here. Okay, A is going to be the scoliosis here. If you're looking at B, that's the lordosis, the increased curvature in the lumbar spine, and then you can see the humpback here in person C. All right, here you go. Here's some good pictures. All right, look how bad that kyphosis is. Now that's really bad. And something like that, you have to be careful with some of these curvatures. Kyphosis probably, but scoliosis, if it gets bad enough, you can have some issues with the underlying organs in the thoracic cavity there. So you have to be very, very careful. So you can see with this person here, they have what's known as an S curve. It goes back and forth like that, like an S. You can have a C-shaped curvature and you have just one big curve going to the side. You can have a double S curve. Here's the different types of scoliosis that you can have. So it varies, and it can also vary in which division of the spine that you're looking at. Yes, that's true. Yes, you too can have a dad bod, but it comes with a lordosis. All right, let's jump into the bones of the vertebral column, okay? Now, we're going to go over some of what we call the common structural features, and you will find, okay, when we're talking about the vertebrae, we have typical vertebrae and atypical vertebrae. So these common structural features are going to be found on your typical vertebrae, because as you go through the different divisions of the vertebral column, right, you'll see that a thoracic vertebrae is going to look a little bit different than a lumbar vertebrae. And I'll go through it and explain that to you, okay? So let's talk about a couple of these structures. All right, the body is going to predominantly be the weight-bearing structure. And I'll show you pictures of this in a moment. All right, so off of the body, you're going to have, all right, these two sections of bone that come off either side. So here's the body, and then you'll have this bone that comes off. And you'll have this hole here where I'm putting the X. And that's called the vertebral foramen. And that's where your spinal cord is going to be. But the vertebral arch is this part that I just drew, all of that big rounded area. That's the vertebral arch. Now, if we start to stack up a bunch of individual vertebrae on top of one another, where I put the X, the vertebral foramen now becomes the vertebral canal, because we've stacked the vertebral foramina on top of one another, so it starts to make a tunnel. And so in that tunnel is where we find the spinal cord. So the body is going to be in the front. This is right here is going to hold all the weight. So here, take a peek. Here's a typical vertebrae. This is specifically a thoracic vertebrae. That's not important right now. So here's the vertebral body. And this is where you'll find the discs. The discs sit right on top of the vertebral body. Okay, that's the weight-bearing structure. Then you'll have the hole behind it here. If it's one individual vertebrae, that's the vertebral foramen. And then all of this right here, that's the vertebral arch. So we're going to walk you through the different parts of the vertebral arch here, okay? So you have these little bony processes coming off. There's 1, 2, and 3. The ones that come off the side, those are called the transverse process. And the one that comes directly off the back is called the spinous process. If you reach around and touch that bone that sticks out, in the back of your neck, that's the C7 spinous process. That's this. Then you'll notice you'll have this little area of bone in between the transverse process here and the spinous process here. We call that the lamina. So when you're developing, the two lamina will come together and fuse and form the spinous process here. But the lamina is back here. Here's the lamina, here's the lamina. Right? Where the vertebral arch basically inserts itself onto the posterior portion of the backside of the vertebral body, we call those the pedicles. So here's a pedicle here, and here's another pedicle here. It's basically where the vertebral arch attaches itself onto the vertebral body. I'll talk about the facets here in a little bit. Okay, so this is a lumbar vertebrae. So you can see here's the vertebral body. The lumbar vertebrae is a big fat vertebral body. Okay, so we know the vertebral body. And then you got the hole behind it. That's the vertebral foramen. And then you've got your vertebral arch, which is all of this. Okay, we're going to talk about now all the parts to the vertebral arch. Okay, so where the vertebral arch connects onto the posterior aspect of the vertebral body, that's the pedicle, this right here. Here's one pedicle, here's the other pedicle. Yeah, exactly. Yeah, really. That's a great point. Yep, it is a moose. I think of it more like an ox, because ox are used to pull things and they're strong and bulky, while the lumbar spine holds pretty much the upper half of your body weight. And so the vertebral bodies are huge. So then you can see, all right, these little things that come off the sides here, those are the transverse processes. And then that one bone that comes off the back, that's the spinous process. And then in between the transverse process and the spinous process, this stretch of bone right here, that's the lamina. Lamina. So you'll find all of these parts, all right, these are common to all of the vertebrae that are considered to be typical vertebrae. I'll let you know when we talk about an atypical vertebrae. Okay, so that brings me into the articular facets. Okay, the articular facets and the superior and inferior articular processes. Okay, so we all know what a process is. It's a projection of bone. Okay, so we've seen it. We saw in the temporal bone. We saw the zygomatic process that came off the temporal bone that helped to make the zygomatic arch. It's this projection of bone that comes off the main bone. Well, that's what these processes are that you're seeing here on the lower vertebrae here. So this right here, this process comes off the top part of that vertebrae. So we call that a superior articular because it's going to articulate with another bone, superior articular process. And then this one down here is called the inferior articular process because that bone is projecting downward and it's coming off the bottom or inferior part of our bone. So that is called the inferior articular process. So now, this other structure here is called an articular facet. The best way for me to describe an articular facet to you is look at your finger. Okay, your finger is the process. It can be a superior articular process or an inferior articular process, doesn't matter. Okay, your fingernail is the articular facet. A facet is a smooth, normally flat surface on a process. And it's smooth and flat, and so that means it is going to be the part of the process that is going to actually make contact with the other bone that it is going to form a joint with. So if you look at these two vertebrae here at the bottom of our page, we're going to take this vertebrae here and let's stack it, all right? Or let's take this vertebrae here and put this vertebrae on top of this vertebrae. So that would mean that this inferior articular process is going to articulate with this superior articular process. You see where I'm going with this? We're going to take this bone and put it on top of this bone. And so this process is going to touch this process. So we'll say the inferior articular process of our vertebrae here on the right is going to articulate or connect to or touch the superior articular process of this vertebrae on our left. And then the actual part of each of these processes that are going to touch each other to form a joint, that is called the facet, the articular facet. A facet is like your fingernail on your finger. Okay, that's the best way for me to describe that to you. So that's what we're going to see here. We've added something. All right, right here. Superior articular process. That's this whole structure, this whole bony projection. And it's coming off of the top of the vertebrae. So it's superior. So superior articular process. Okay. So over here now we've added something new. Superior articular facet is going to be this smooth, flattened surface here. Okay. Smooth, flattened surface is called the superior articular facet. So you could say that the superior articular facet is on the superior articular process. Okay, so a couple other structures that I want to bring to your attention. Okay, we have this structure here called the intervertebral foramina. So this is only present when we have two adjacent vertebrae that are stacked on top of one another. And I'll show you a picture to show you what I mean by that. But when we stack them on top of one another, they're going to create a hole, a rounded hole. Remember what a foramina is? It's a rounded hole in a bone. So when we stack these two vertebrae on top of one another, they're going to create this little hole. And what comes out of this hole are nerves, specifically spinal nerves. What's a spinal nerve? A nerve that comes off the spinal cord. Hey, Dr. Kaz, what do we call the name of a nerve that comes off the brain? That's an easy one, student. We call that a cranial nerve. So if it's a nerve that comes off the spinal cord, spinal nerve. So as you know, nerves need to come off the spinal cord because they have to go out to the body somewhere. So when they come off the spinal cord, they have to leave the spine somehow. And so they leave the spine through these holes, these openings called intervertebral foramina. And they're found on the sides, the lateral openings. I'll show you a picture here. Okay, so going back to our vertebral arch, we talked about these structures already. Okay, so where the vertebral arch makes contact with the posterior portion of the vertebral body, we call that the pedicle. And then that part of the vertebral arch in between the transverse process and the spinal or spinous process, okay, that'll be in the back and in the middle, that's called the lamina. So here I'll zoom in and show you a nice picture. Where are you? Okay, so you can see we've stacked these vertebrae on top of one another and they form these passageways here on the side of your spine. Okay, and that's where your spinal nerves come out. They'll exit out in between. So you're only going to have intervertebral foramina when you have vertebrae stacked on one another. And so now we can see where those intervertebral discs lie. They lie in between the vertebral bodies. Okay, so intervertebral foramina, look at the name of these structures. Intervertebral, between two vertebrae. Intervertebral discs are in between, are the discs that are found in between two vertebrae. Intervertebral foramina is a foramina found in between two vertebrae. The names will help you with that. All right, we've talked about the spinous process. Okay, when the two lamina form and come together, they make a projection that comes off the posterior aspect of our bone, and that's called the spinous process. The lateral projections are transverse processes. They come off of both sides of the vertebral arch. And then we have our superior inferior articular processes. If it's on the top of the bone, coming off the top, that's a superior articular process. If it's coming off the bottom, it's an inferior articular process. And the smooth surface on those structures, okay, the smooth surface on either process is known as the articular facet, like your fingernail on your finger. Right? Talking about the intervertebral discs. Intervertebral disc is made up of fibrocartilage. Okay, and that's going to be found in between two vertebral bodies. Our vertebral disc is like a jelly donut. Okay, so here's our disc. And on the inside, you've got the jelly. So the inner jelly donut portion of our vertebral disc, or our intervertebral disc, is called the nucleus pulposus. It's gelatinous. So when you get a disc herniation, the jelly in your discs has squirted out. Right? The jelly, all right, or the nucleus pulposus is surrounded, all right, by these rings of fibrocartilage called the annulus fibrosus. So the jelly has to squirt out through the annulus fibrosus. Okay, so as we know, fibrocartilage is a shock absorber, helps to resist compression. Okay, it also allows, all right, for some flexibility in the spine. All right. Blah, 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 blah. I'm going to skip that part. Okay, this slide is important because we've talked about some of the common features to the typical vertebrae, but if you look at these vertebrae here, and you can see they're from the three divisions of your spine, the cervical, thoracic, and lumbar divisions, you'll notice that these vertebrae, although they have similar features, they don't look the same. Okay? And part of that has to do with, all right, remember, anatomy has to do with physiology. Okay? Form and structure follows function. What that means is, look at the lumbar, for example. Look at the size of the vertebral body. It's big and flat and fat. And that's because the lumbar, your low back, does your weight bearing. So it has to be big because of all the compressive forces there. If you look here at the cervical vertebrae, its vertebral body is small. Okay, because it only has to support the weight of your head. The average weight of the human head can be anywhere from 10 to 16 pounds, like a bowling ball. Okay, so you'll notice though, on the thoracic spine, we have a longer spinous process. The spinous process in the lumbar spine is smaller. It's like a nubbin. All right, so just notice some of the differences here. You're probably looking and noticing, hey, wait a minute, we got some holes here in the cervical vertebrae. Okay, those are called transverse foramina. We'll talk about that in a moment. Okay, that's where your vertebral artery travels through. But you'll see over on the thoracic and lumbar, you don't have those. So it's these differences, and you should study that as you're going through and reviewing, all right, these bones. You should study that and notice those differences, because you could be asked on a test, you could have one of these three vertebrae thrown up there. And in fact, I take that back. You will be asked this. And you won't be asked this once. You won't be asked this twice. you'll be asked this at least 3 times, possibly more. It's a 2-part question, and there's several of them on the test. It'll ask you, you'll have an arrow pointing to this transverse process. And so the first part of the question is, what is that? And then it'll say, right, which division or what part of the spine will you see this in? And you'll have to say either thoracic, cervical, or lumbar. Okay, so you'll have to know that's a transverse process, and then you'll have to know in which part of the spine you'll find that. So as you're studying the vertebrae here, really start to study and see, all right, what division, okay, that you're going to find these vertebrae in. Okay, let's start with the topmost division of the vertebral column and talk about your cervical vertebrae. Okay, so again, like I said, these vertebrae, the only thing they have to support is the head. And so these will usually be the smallest ones, but they have the transverse foramina, which are going to be located in the transverse processes. And so that is going to be one of the distinguishing characteristics of vertebrae that are found in the vertebral spine there. Okay, and those transverse foramina are going to contain the vertebral artery and vein. The vertebral artery, or arteries, because you have a left one and a right one, they supply 20% of the blood to your brain. You should know that. It's important. So we have our very first atypical vertebrae, the Atlas. If you know anything about Greek mythology, Atlas was a Titan, and Atlas was punished in having to hold the earth on his shoulders. So the skull is the earth, and the first cervical vertebrae is Atlas. And so the Atlas holds the skull on top of itself. Okay. And so we also will call Atlas C1. You can call it C1 or Atlas. It's really up to you. And so it's the C1 vertebrae that articulates with those occipital condyles. We saw those. Those are on the occipital bone on either side of the foramen magnum. And they form the Atlanto-Occipital Joint. And this joint, because of the way it's shaped, all right, does one simple motion, moving your head forwards and backwards, or flexion and extension, basically nodding your head. Yes, dear. Yes, yes, ma'am. Yes. Okay. So where the occipital condyles come in contact with the atlas, all right, those structures we call lateral masses. I'll show you a picture here. All right, let me show you a better one. There's the atlas right there. Okay, there it is. And you can see where it's positioned here in relation to the skull and the other vertebrae. All right, so there's a couple parts to this vertebrae that you should know. Okay, these structures where I'm drawing the X's here and here, those are the lateral masses. And the occipital condyles will sit right on top of those. So if we're looking at it from the side, here's an occipital condyle hanging down, and then the lateral mass sits right underneath it like this. It's shaped like this. Like that. We can't see it because we're looking down into it from that view. Okay. So in the center of the vertebrae, we have the vertebral foramen. Makes sense because that's where the spinal cord is going to go. And then we have the transverse process, the projections that come laterally off of the side of the vertebrae. And then we have the holes in the transverse process, and that's the transverse foramen. Right, and the transverse foramen in our cervical vertebrae, that's where the vertebral artery and vein will travel in. Okay, the next cervical vertebrae is the axis. Bing, 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 bing. Second atypical vertebrae. Our second atypical vertebrae, also known as C2. You can call it that. So on a test, if you want to just write in C2, you're good. All right, or C1 for the atlas. You can use the name or you can use the nomenclature here with the letter and the number. Okay. And so we have a projection that comes off the body of the axis. And that's called the dens, or you can call it the odontoid process. I know what I would prefer to call it if I was taking a test. Okay, 4 letters is a lot easier than 8, 15 letters. Okay, less chance of misspelling. Okay, so what it does is the dens is this bony projection that projects superiorly off of the body of C2, and it projects up into the atlas. And so it allows the atlas to pivot around C2. And so what that does is it creates the Atlanto-Occipital Joint, and it allows us to shake our head from side to side. Like what my kids used to do, if I wanted them to have more broccoli, they would shake their head no. Okay, so it looks kind of like this. So here's the dens, projects upwards, and then the atlas would be around it like that. There's a better picture. Actually, I could show you right here. Yeah, so here's C2, okay? Here's the body of C2. Here's the dens or the odontoid process. And so it projects upwards, and then the atlas sits right in front of it. And there's a ligament that holds it together. And it allows you to shake your head from side to side to say no. You can see it right here. So this is the dens. Oh my gosh, what the heck? All right, there's the dens right there. Okay, so a little bit of labeling here, okay? You can call it the dens of the odontoid process. Now you can see that this arrow here is pointing to a flat surface on the bone. So that is the superior articular facet. That's the nice flattened surface. Okay. You can't really see it here. I think this is a horrible view for the transverse foramen. You can't even tell what the heck that's pointing at. But you'll see this lateral projection coming off of the side of the vertebrae, and that's the transverse process. All right, here's the vertebral body. And then you have, this is the vertebral arch, all of this. And so where the vertebral arch attaches onto the vertebral body, there's your pedicle. The lamina is back here, because the lamina is going to be found between the spinous process and the transverse process. Now, if you notice, the name of this spinous process is called a bifid spinous process. And we call it a bifid spinous process because you have these 2 little nubbins here, one here and one here. So if you have a spinous process that has those 2 nubbins, we call that a bifid spinous process. All right, here you can see this beautiful picture here of the atlas on top of the axis here. C1 is on top of C2, and then you've got your transverse ligament. This is the ligament will hold, okay, the atlas up against the dens right here. And so that allows you to shake your head no. That little tiny ligament. All right, there's tons of muscles in there, so it's not like it's just hinging on that one ligament. There's other things involved. Okay. All right, so you should have this picture in your book, and you can see that in your lab atlas, right, how the 2 vertebrae are going to be in position with one another. And so you can see much better here. Here's the transverse foramen for C2. There's the transverse process. You can see this is a really nice example of a bifid spinous process, these 2 nubbins hanging off. Okay. C1 or atlas doesn't have a spinous process. C2 does. All right, you can see the atlas axis on the CT scan nicely there. All right, this is the vertebral prominence, C7. is just that really big spinous process that you're feeling in the back of your neck. That's basically what it is. Okay, so we call that the vertebral prominence. You don't have to label that for the test, but figured that you'd like to know, because I said before, all right, the spinous processes in the thoracic spine are nice and long. And one of the things that you'll start to see is as we move from one division of the vertebral column to the next division of the vertebral column, you'll see that those vertebrae, all right, will for example, the bottom vertebrae of the cervical spine, okay, the closer you get to the next division, all right, you'll start to see the remaining vertebrae in the first division start to take the characteristics of the vertebrae in the second division, meaning, okay, the vertebra, the vertebra that are in the bottom portion of the cervical division, like say C6 and C7, they'll start to take on the characteristics of the thoracic vertebrae, like T1 and T2. And then the same thing will happen in the thoracic division. As we get towards the bottom of the thoracic division, all right, you'll start to notice things like the thoracic bodies, the thoracic vertebral bodies of T11 and T12 will start to get fatter and start to look more like the lumbar vertebral bodies of L1 and L2. Man, that took me a long time to articulate that. Ay, ay, ay. All right, so here's C7, the last vertebra in your cervical division, and you can see that's the one that you feel, that's spinous process. So these spinous processes, they're not too bad, but then the C7 really starts to take on that thoracic appearance because it starts to get pretty long. All right, now we're looking here at a typical cervical vertebrae here. Okay, so this would be C3, C4, C5, and C6 and C7. So again, you'll have here the vertebral body. Okay, you'll also have the vertebral foramen, our spinous process. Now this is bifid, it just busted off here. Okay, it's still bifid. So you have your spinous process, you have your transverse process coming off the side, and then you'll notice your transverse foramen here. And then where the vertebral arch attaches onto this vertebral body, there's the pedicle. And then this part of the vertebral arch, here's the lamina. And where the two lamina come together and fuse, they form the spinous process here. And then we have our superior articular facet. Again, this is a nice flattened surface here. The superior articular facet is going to sit on top of the whole superior articular process. Okay, just think of your finger and your fingernail. All right, here's a lateral view. Lateral view of the superior articular process. Okay, so this is a great example. You can see the difference between the superior articular facet and the superior articular process. Look at the arrow. It's pointing off to the side for the process. The superior articular facet is pointing to the flat surface there. So that's what we want. Same thing down here. Here's our inferior articular process. That's that bony projection coming off the bottom of the bone. And then that flat surface is the inferior articular facet. Okay, here's our spinous process here, the vertebral body. Okay, you have your transverse process, and then the opening here to the transverse foramen. All right, let's get into the thoracic vertebrae. Thoracic vertebrae, we have 12. Okay, they articulate with the ribs. All right, now again, you don't need to know this for the test, but you've got your costal facets and what we call demifacets. Okay, I already told you what a facet was. A facet is going to be, all right, the surface that is going to articulate one bone to another bone. Okay, So in the thoracic vertebrae, these costal facets and these demifacets are basically going to be found on the sides of the vertebral body and the sides of the transverse processes, because that's where the rib is going to articulate. Specifically the head of the rib. That's the rounded edge of the rib. So we'll talk about that later on when we're talking about the ribs. So the head of the rib is either going to articulate with the costal facet or a demifacet. So you'll notice also on ribs, right, you'll have the head, which will be this one end of the rib, and then the head kind of tapers down a little bit, and it turns into what we call the neck of the rib. And then there's going to be another kind of bump on the rib before we get to the shaft. The head articulates with the body of the vertebra. This other bump here is called the costal or rib tubercle. And that costal or rib tubercle is going to articulate with the transverse process. So these ribs, and I'll show you a picture to help you understand this later on. All right, these ribs are going to articulate with the vertebra twice. Once on the head, on the vertebral body, and second on the transverse process. All right, so we'll talk about that here when I get to the ribs. All right, so here you can see, all right, a lateral and a superior view. So again, a lot of the same characteristics because these are typical vertebrae. So we're going to have vertebral bodies. We're going to have our nice spinous processes here. We're going to have our transverse processes, our vertebral foramen, our pedicles, okay? We're also going to have superior and inferior articular processes with their associated facets. Okay, so we're going to have all that. But now on the transverse process and on the vertebral body, you'll notice here on the side, we have our costal facet, and that's where the head of the rib is going to articulate with. And then you've got another facet over here, right? And that's where the tubercle of the rib is going to articulate with. When we get to the ribs, you'll see that better. All right, let's jump into the lumbar vertebrae. This is the largest type of vertebrae, okay? So the nice thing is we don't have to worry about transverse foramina, okay? So no holes in our transverse processes, and we don't have to worry about costal facets because we don't have any ribs. All right, but these vertebrae do have to carry the lion's share of the load or bear most of the weight of the body, at least for the upper half of your body. Okay, so lumbar vertebrae have a big burden. So you can look at the size of that vertebral body there. It's huge because it has to hold all that weight. So again, this is a typical vertebrae, so we're going to see all the structures that are common to typical vertebrae. Vertebral body, okay, vertebral foramen, transverse process, spinous process. Then we have our pedicles, okay, that's going to be where the vertebral arch attaches itself. And then you have your lamina, okay, that's the posterior medial portion of the vertebral arch. Okay, found in between the transverse process and the spinous process. Here's a superior articular process. And then we have our nice smooth surface here. That's our superior articular facet. So I feel like you folks should know this. By now, this should seem repetitive. So let's look at a lateral view here. Here's our nice stumpy, all right, spinous process. This is a beautiful, let me just circle this before I say out loud. This is a beautiful example of an inferior articular process, this whole thing. Okay, but where the arrow is pointing, it's pointing right there into that smooth surface there. So that's the inferior articular facet. Transverse process here is coming out at us, and you can see nicely where the pedicle is in its close approximation to the vertebral body. All right, so now we're going to move into the final areas of the spine here, and we're going to talk about the sacrum and then the coccyx. Okay, so the sacrum is just a triangular bone. Okay, it's going to be found in the posterior area of the pelvis there. Okay, so at the top of the sacrum, we call that the base. That's on the superior portion. And then at the bottom, so if I draw my sacrum, so here's the base, and then the apex is down here. Base is on top, okay, apex is on the bottom. It's projecting inferiorly. So here's our sacrum, okay? This is the anterior view of the sacrum, and then this over here is obviously the posterior view. So we talked about it before. At one point, the sacrum was 5 individual vertebrae. They fused somewhere in your 20s. And then where those disc spaces used to be, all right, much like when we talked about the growth plate, all right, when the discs go away because of the fusion, it leaves these lines behind, and we call those transverse lines or transverse ridges. And so the sacrum will directly articulate with L5, the last individual vertebrae of your spine. So you can see here on the sacrum, it has its own pair of superior articular processes, which will, of course, have, each of them will have a superior articular facet. And the superior articular processes of the sacrum are going to articulate with the inferior articular processes of L5. Now we'll see in the sacrum, all right, a continuation of the spinal canal. That's called the sacral canal. And we're going to talk about some of the characteristics of the spinal cord at that point, because at that point, it's not a cord, all right? It's something else, okay? It's like a horse's tail, okay? They call it the cauda equina. I'm not going to get into that right now. We'll talk about it when we get into the spinal cord, okay? But anyways, the remains of the spinal cord will be found in that sacral canal there, all right? So on the sacrum, you probably noticed that there were holes in the sacrum, okay, several in fact, and we call those sacral foramina. Now, if you're looking at it from the front, then we call, and you see the holes, you call those the anterior sacral foramina. If you're looking at it from the back, it's called the posterior sacral foramina, right? And so remember what we said, foramina are rounded holes in bone, and it's usually the passageway for a blood vessel or a nerve. Well, in this case, it's going to be the nerves that go to all the pelvic organs and all your butt muscles. Okay. Don't worry about the median sacral crest. The ala are going to be the lateral surface of the sacrum. I'll show you that in a moment. And then where the sacrum articulates with your hip bones, all right, or the os coxa, right, we call that the auricular surface. So when the hip bones are in place, all right, with the sacrum, you won't see the auricular surface because they're covered up by the hip bones there. And it forms one of my favorite joints, the sacroiliac joint, one of the strongest joints in your body, in fact. All right, so this is an anterior view of the sacrum. Okay, so the ala are going to be here off onto the sides. And then since we're looking at it from the front, then we call those holes the sacral foramina. To be honest, I don't care if you say anterior sacral foramina or posterior sacral foramina. If you put sacral foramina on the test, I won't mark you wrong, okay? Sacral, it doesn't matter if it's from the front or the back, to be honest with you. All right, and there's the auricular surface. Again, that's covered up with the hip bone there. You won't see that, right, in the pelvic girdle. All right, our final bone of the vertebral column is the coccyx, right? Really nothing going on there. I mean, at one point it was individual vertebrae that have all fused together, and there's a possibility that the coccyx can fuse onto the sacrum, all right? But this is, again, an attachment site, and I mentioned that before, for several ligaments and from the muscles there. And there you can see the coccyx. There's the sacrum and the coccyx separated from one another. All right, so disc herniations. Real brief, I know I mentioned this before. Remember that the disc is made up of, all right, two components, the nucleus pulposus and the annulus fibrosus. The annulus fibrosus is that fibrocartilage ring-like structure that contains the nucleus pulposus. What will happen is the nucleus pulposus finds a weakness in the annulus fibrosus and it squirts out, okay? So you can get it where it doesn't squirt out, where it just causes a bulging, basically like if you were to puff your cheeks out, right? Or you can get a herniation, and that's basically when the jelly components of the vertebral, intervertebral disc squirt out. And normally it'll squirt out posteriorly into the vertebral canal. Well, what's in the vertebral canal? Your spinal cord and spinal nerves. So it'll pinch or put pressure on either one. It could do it on both, or it can do it on one or the other, okay? And so we most often will see disc herniations in the lumbar spine because it bears most of your weight. But the two common areas are going to be in the cervical and the lumbar spine, where you're going to have disc herniations. Very rarely do you see somebody with a thoracic disc herniation. And if you do, it's usually because of some sort of trauma. So if you get a disc herniation in the cervical spine, you're going to feel numbness and or pain and tingling in the upper extremity, down your hands, down into your arm. If it's in the lumbar region, you can have low back pain, and you can have it go down your lower limb. Now, this is garbage, okay? You can only call something sciatica if the sciatic nerve is affected. Just because you have pain, all right, because you're pinching a nerve in your low back and it goes down into your leg, down to your knee, that's not sciatica. It has to be the entire lower limb. Okay, so I shouldn't have said that that was garbage, but usually when people see something like the lower limb, that could include the thigh. Okay, it has to go down the entire lower limb for it to be known as sciatica. All right, thoracic cage, here we go. Okay, so what makes up the thoracic cage? Your ribs and your sternum, okay, which is your breast bone there. So let's talk about that, okay? So when we're talking about the thoracic cage, your spine, specifically the thoracic vertebrae, will make up the boundary in the back. The ribs come off of the thoracic vertebrae and they wrap around towards the front. So the ribs will make up the lateral boundary and the sternum will make up the anterior boundary. All right. So again, the thoracic cage offers a protective function for the organs that reside underneath your heart and your lungs, but also it allows for muscles to attach to. Tons of muscles, intercostal muscles, which help you breathe, some of the muscles of your head and neck, which help you to move your head up and down, okay? Pectoral major, we'll talk about these muscles that help you to manipulate your upper extremities there. So the bones of the thoracic cage are going to include your sternum, which is the breastbone. And that's made up of 3 smaller bones. Okay, so the entire sternum is made up of 3 bones. Again, it's a flat bone, no medullary cavity present whatsoever. The superior portion of the sternum is called the manubrium. So the manubrium looks kind of like this. Okay, so at the top, the widest portion there, you're going to have a notch. I didn't draw it in here, but you're going to have this notch here. All right, a couple different names for that. Suprasternal notch or the jugular notch. Okay, that's an anatomical landmark. It's important that you're able, you can actually, I'm feeling mine right now. If you find your 2 collarbones there, all right, those are called the clavicles, move inwards to the center, all right, and you'll see that the suprasternal or jugular notch is right in between your 2 clavicles there. The second part of the sternum is the sternal body. This is where we'll see your 2nd through 7th ribs are going to attach there. Now, above the body, the manubrium is going to attach, and where they attach, they create this guy called the sternal angle. And it's another anatomical landmark, and then you can palpate it out on yourself. Find the jugular notch, keep going down, and you'll start to feel where on your sternum there, there's a little bit of a projection that moves forward. That's where your 2nd rib attaches. Also, if you're trying to listen to the heartbeat, that's where you'll start to listen to your aortic and pulmonic heart valves. Okay, so it's a very important anatomical landmark. You should know that. Okay, so again, that's why I say it's important so you know when you're starting to count the ribs, right? Because you're going to use the ribs to help you find certain anatomical structures. The last portion of your sternum is the xiphoid process. Follow all the way down. You'll feel this little pointy structure there. Okay, it's at the tip of the sternum here. All right, it doesn't completely ossify until the 4th decade of life. So here's your sternum. There's the manubrium. There's the sternal body. There's the xiphoid process. Let's take a peek. Let's get that. There you go. So this is the sternal angle right here. And you can see that's where the costal cartilage of your 2nd rib attaches. Your 1st rib attaches onto the manubrium right here. And then the remaining costal cartilages, this is all for ribs 2 through 7. Here you can see. Now look at the manubrium up above. There's the suprasternal notch, all right, also known as the jugular notch. And then you can see if you count down, your first 7 ribs will directly, their costal cartilages will directly articulate with the sternum. Here's 2, here's 3, 4, 5, 6, and 7. You can see the costal cartilage from 7 goes all the way up and attaches. Because we're going to talk about true ribs versus false ribs here in a moment. Let's talk about ribs right now. Again, we talked about the ribs before. They're flat bones. Okay, where do they start? At the thoracic vertebrae. Where do they end? All right, at the costal cartilage there that's going to articulate with the sternum. So we have 12 pairs. The first 7 pairs, we call those true ribs. Another name for them is vertebral sternal. What does that mean? Well, the first part of that name, vertebral, tells you the origin, right? They originate on the vertebra. Where do they wind up? On the sternum. Okay, and they wind up on the sternum through, all right, the costal cartilage. Okay, so those are true ribs. You need to know that. You'll have a test question on it. Ribs 1 through 7, true ribs, or because it'll also ask you, you should know both names because it'll ask you another name for a true rib, vertebral sternal. Okay, so the second type of ribs are called false ribs. So basically, that is the remaining ribs, 8 through 12, okay? And their costal cartilages, if they have any, do not, it's important that you know this, they do not directly attach to the sternum. Okay, so there's 2 types. The first type, which is ribs 8 through 10, we call those vertebral chondrol. The first part, again, vertebral, because they're originating from the vertebra, and then chondrol has to do with cartilage. So basically the cartilage from ribs 8, 9, and 10 are going to fuse with the costal cartilage of rib 7. Let me show you. Look down here. You can see down here, okay, here's rib 7, okay, 8, 9, and 10, their costal cartilages are going to fuse right here onto rib 7. Let me make sure I got that right. 2, 3, 4, 5, 6. Yeah, 7. So you can see their costal cartilages attach onto rib 7's costal cartilage. Okay, so they indirectly attached to the sternum, hence false rib. Now, the last two ribs, 11 and 12, they do not connect to the sternum at all. So we also call those floating ribs. But you should know this word too, vertebral ribs, which just means they only come from the vertebra and they don't attach to anything else. So you need to know those. It's important that you know those. This picture here shows, all right, your last two floating ribs or false ribs, or excuse me, not false ribs, vertebral ribs, 11 and 12. They don't attach to anything. Okay, so the true ribs, ribs 1 through 7, false ribs 8 through 12. Okay, a couple parts of the ribs, then we'll wrap it up. Okay, the end that is going to articulate with the vertebra, okay, is called the vertebral end. That's been asked on a question before. So you'll have a rib, and it'll say which end is this. If it has the vertebral, excuse me, not the vertebral head. If it has the rib head or the costal head, right, then that's the vertebral end. All right, the other end is what we call the sternal end. Okay, so wherever the head is, and I'll show you a picture of the head in a second, that's the part of the rib that's going to articulate with the vertebral body, okay, in the thoracic spine. Then the head tapers down, and then we have the neck. It's a thinner area. Then you're going to see a bump, a second bump on the rib. That's the tubercle, and that's the part of the rib that is going to articulate with the transverse process of the thoracic vertebra, which was what I was telling you about before. Okay, and then when we start to see the rib curve towards the front, all right, that's the angle of the rib. And then on the underside of the rib, on the inferior border, also on the internal border, right, we have a groove there. And that's where the nerves and the blood vessels for those ribs are going to run. Okay, so first of all, this end here with all this stuff here, that's the vertebral end. Where the rib starts to flatten out here, that's the sternal end. So this first bump or knob at the end of the rib, that's the rib head or costal head. Then it kind of tapers down for a brief period here. That's the neck. And then you got this bump here. That's the costal or rib tubercle. This will attach onto the vertebral body. This will attach onto the transverse process. So here you can see, here's the rib head, and it's articulating here onto the vertebral body. Then you have the neck. Then you got that second bump, that's the tubercle of the rib, and it articulates here with the transverse process. Woo! That's it. I'm proud of you folks. You did great. You did good.